Which of the following medications are proton pump inhibitors commonly used in the treatment of peptic ulcer disease? Select all that apply. A. Omeprazole. B. Ranitidine. C. Pantoprazole. D. Famotidine. E. Esomeprazole. Correct answers A, C, E. Omeprazole, pantoprazole, and esomeprazole are proton pump inhibitors. Ranitidine and famotidine are H2 blockers. What signs would indicate the development of pyloric obstruction in a patient with peptic ulcer? Select all that apply. A. Frequent projectile vomiting. B. Abdominal bloating. C. Weight loss. D. Diarrhea. E. Lack of bowel movements. Correct answers A, B, C. Obstruction causes vomiting, bloating, and malnutrition. During discharge teaching for a patient with peptic ulcer disease, which lifestyle modifications should the nurse emphasize? Select all that apply. A. Stop smoking. B. Avoid alcohol. C. Limit intake of spicy foods. D. Take medications irregularly. E. Manage stress levels. Correct answers A, B, C, E. Lifestyle factors greatly influence ulcer healing. Medication adherence must be consistent. A patient presents with anemia from chronic peptic ulcer bleeding. What findings would support this? Select all that apply. A. Fatigue and pallor. B. Tachycardia. C. Hypertension. D. Shortness of breath. E. Weight gain. Correct answers are A, B, and D. Anemia causes pallor, tachycardia, and dyspnea. When educating a patient with peptic ulcer disease on cytoprotective agents such as sulcrafat, which points are important? Select all that apply. A. Take on an empty stomach. B. It forms a protective coating on ulcers. C. Avoid antacids within 30 minutes of this medication. D. It kills H. pylori bacteria. E. Complete full course as prescribed. Correct answers are A, B, C, and E. Sulcrafate works best on empty stomach, requires separation from antacids, does not kill bacteria. Adherence is important. The nurse should advise a peptic ulcer patient to avoid which of the following medications? Select all that apply. A. NSAIDs such as ibuprofen. B. Aspirin. C. Acetaminophen. D. Antacids. E. Corticosteroids. Correct answers are A, B, and E. NSAIDs, aspirin, corticosteroids increase ulcer risk by mucosal damage. Acetaminophen and antacids are safer. Post-operative care of a peptic ulcer patient involves which nursing actions? Select all that apply. A. Monitor vital signs frequently. B. Assess NG tube drainage for color and amount. C. Encourage early ambulation. D. Manipulate NG tube regularly. E. Position unconscious patients in SIMS position. Correct answers A, B, C, E. Vital monitoring detects complications. NG drainage assesses bleeding. Ambulation aids recovery. Tube manipulation avoided to prevent injury. Patient teaching for antacids should include which of the following? Select all that apply. A. Take antacids 1 to 3 hours after meals and at bedtime. B. Antacids neutralize existing stomach acid. C. Antacids are a cure for Helicobacter pylori. D. Avoid taking with other medications within 1 hour. E. Report if pain persists despite medication. Correct answers A, B, D, E. Proper timing maximizes effect. Antacids do not eradicate bacteria. Drug interactions possible. Persistent pain needs evaluation. During assessment, what findings suggest hemorrhagic complication in peptic ulcer disease? Select all that apply. A. Hypotension and tachycardia. B. Coffee ground emesis. C. Melena, black, tarry stools. D. Fever and chills. E. Pallor and diaphoresis. Correct answers: A, B, C, E. These signs indicate blood loss. Fever and chills suggest infection.
The nurse is evaluating a patient with suspected pyloric obstruction from peptic ulcer. What clinical signs should be assessed? Select all that apply. A. Vomiting of undigested food. B. Abdominal distension. C. Early satiety. D. Frequent diarrhea. E. Weight loss. Correct answers: A, B, C, and E. Obstruction delays emptying, producing vomiting, distension, satiety, and weight loss due to poor intake. Diarrhea is unlikely. Great job making it to the end of Part 2 of Peptic Ulcer. Select all that apply NCLEX questions and answers. How many questions did you get correctly? Drop your score in the comment section below. I'd love to see how you did. Make sure to subscribe and turn on the bell notification to get notified when we drop our next video.